listen-only mode.
Hello, and welcome to our session today. We are covering communicable illness, flu season today, and in conversation in the planning for this month's session, we discussed the natural disasters that we had observed that were occurring across the country and how those affect health, especially those for schools and school administrations. And so we wanted to include into a straight communicable illness session information on illnesses that are a result or an impact of natural disaster and people who may have evacuated from one region to another and new communicable illnesses that may be introduced to a region because of that. So that's really the basis for today's session. We appreciate all of you who've joined us. You can watch recordings of these sessions or share recordings of these sessions with others, and you'll receive a confirmation email once the session is over with links to where you can do that. If you have any questions, our moderator, Bill Baker, is standing by, and you can type those into the chat area of the GoToWebinar dashboard console thingy. And this is the 10th session, or the 11th session in our Firestorm 2017 Crisis Coach webinar series, and we appreciate your joining us today. If you'd like to engage with us on social media, we welcome that opportunity, and you can follow us on Twitter at Firestorm Soul. We're on Facebook as Firestorm Solutions. And if you have a question during this session or at any time, and you use the hashtag Crisis Coach, we're pretty much the sole users of that hashtag. We'll see it and we'll respond to you. You can always email us at webinars@firestorm.com or contact us via firestorm.com website. There are contact forms all over that website, so please do. Firestorm transforms crisis into value, and we empower you to manage crisis and risk. Our expertise is in crisis management, critical decision support, crisis communications, crisis public relations, and consequence management. We are your crisis coach for crisis and risk, and we follow a Predict.Plan.Perform methodology. Our attorneys tell us that no presentation is complete without the accompanying oral comments and discussion. And any work product provided by Firestorm should be read in conjunction with all guidance given by national, regional, and local authorities, as well as, of course, your company or organization's personal counsel. Moreover, the information given and comments made in this webinar should not be interpreted as legal advice or legal opinion. We'd like to thank our wonderful friends at RenWeb, a fax company. RenWeb has powerful integrated solutions to connect administrators, the classroom, and the home. And that's really what we're talking about today. When it comes to communicable illness communication plans and programs, we want the ability to integrate those so that administration, the classroom, and the home are all on the same page. Because this series is underwritten by the good folks at RenWeb, should anyone on this call today want to reach out and schedule a 1-hour, no-fee, high-level guided assessment on your current plans and programs, it doesn't have to be just about communicable illness. You may have other confidential questions you'd like to discuss with a Firestorm principal. We'll be happy to make that happen, and because you are coming in through the RenWeb organization, there will be no fee attached to that hour. So we look forward to speaking with you, again, through firestorm.com, and you can also watch past webinars and register for future sessions from the site as well. I am Karen Masulo. I am our Chief Intelligence Officer, and I am very happy to have my good friend, Ken Mercer, on the call today. And Ken is a principal with Firestorm, and he has a very specific skill set that lends itself very well to our subject matter today. And so, Ken, would you like to introduce yourself and tell us a little bit about why we picked you to share with this session this month.
Thanks very much, Karen, and thanks for the RenWeb folks joining us. I appreciate the opportunity to talk to you. I am a graduate of the West Virginia University School of Pharmacy. I am a licensed pharmacist in 3 states, but I practice in Maryland. So the reason I'm on here today is to bring a healthcare background to this conversation. I have 3 kids and 2 grandkids. One of my children, in fact, is my Firestorm business partner. So some of you may have interacted with Ryan Mercer over the phone in the past few years. I was recently appointed to the Academic Advisory Committee for the Emergency Management Program at Frederick Community College. They offer a 2-year associate's degree in emergency management. They have both traditional on-campus programs and online programs. So if there's anyone in our audience today who might be interested in this course of study for your future, I'd encourage you to check them out. Feel free to contact me for more information. My email address is on the screen. And we're talking about communicable illness today. We're really going to talk to 2 different audiences. The first audience is individuals, and our message will be about personal preparedness and what you might do if faced in some of these disasters. The second audience is school administration. You are running a business, so communicable illness, if you see it, will impact your business. You will have staff and students who aren't available to you. They can't come to work. So how are you going to continue to run your business in the face of those problems? So that's what we're going to cover today. Thank you very much.
That was a great introduction. Thank you, Ken. And I personally live in the Charleston, South Carolina area, and am fortunate that one of Ken's other children, his son Nick, lives here. So it's a small world, and I'm happy to be in it. Okay, so if you look at your screen today, you're going to see a survey that we conducted that you may have participated in last year. And we asked if you had personally read your school's communicable illness plan. And about 62% of the people said yes. And we are pleased to see that because that number was up from the previous year. So we're happy to see that people were increasing their familiarity with their communicable illness plans. However, almost 40% of the folks said they'd either never seen their communicable illness plan or didn't know what one was. So we still have some work to do. And if you're working on yours in your organization, we want to help you get a kickstart on that. So in this session today, we're going to talk first in the first half about natural disasters and their impact. And for those of you in Texas, and I know we have a large audience from RenWeb in Texas, if you have been affected by recent natural disaster events, we want to help you. If you're still recovering and you're not quite sure what to do or you have specific concerns and needs, please reach out to us. You can call our 1-800 number or email webinars@firestorm.com. You will get the lovely and attractive Bill Baker, who will make sure to triage your call and will make sure to help you in whatever situation you may be. If you're planning now for the future, thank you. We really want to see that happen. And if you're shoring up your existing plans and programs, again, we're here to help, and we can conduct any of those no-fee assessments for you at your convenience. Let's start off then with the natural disaster side of things, and then we'll walk into the standard things we know are going to happen in influenza and flu and communicable illness. And so, Ken, could you speak to this slide for me? Talk to us a little bit about what we're seeing on our screen and what risk factors and onset of communicable diseases following natural disasters means.
Thank you, Karen. Again, this all relates to keeping your business viable. You need folks in their workplaces in order to do that, and a good communicable illness plan will allow you to do that and manage when you have an incident of absenteeism that might be up to 40%. At the bottom of the bottom axis are the illnesses, the things we see after a natural disaster. A variety of different things that typically you don't see, but we have those things in the form of waterborne diseases, airborne diseases, vector-borne, those that come through a varmint or a rodent. Mosquitoes carry a lot of these. Across the left axis, we see the conditions that are prevalent during a natural disaster. We have populations displaced. They are in overcrowded and close quarters. We have stagnant waters in the surrounding environment. We have contaminated water and poor sanitary conditions. All of these things lead to the problems at the bottom, on the bottom axis. If you can eliminate any of these, then you reduce your chance of those problems. We have displaced people living in tight, crowded spaces. Those spaces often lack food, lack clean water, and lack general cleanliness. Minor illnesses and injuries that happen during the disaster go without treatment and then progress on. They lack treatment because the healthcare system in the area is damaged. We have damaged buildings, we have damaged supply chains. They don't have the stuff to treat them. And they have a shortage of staff also. Their folks are living in the same community, so they're not able to come to work. So the message here is be your own first responder. The things we're going to talk about today you should keep in mind as keeping yourself free of communicable illness during a disaster like this.
And we know that out of all the natural disasters that we see, the most common or prevalent that we will see in addition to wildfires, we're going to talk about that in a little bit, is flooding. Flooding from rains, flooding from overflow of dams and rivers, hurricanes, etc. And mortality rates are found to increase by up to 50% in the first year post-flood. We all saw this just recently with Harvey. So we saw an event that we knew was going to be bad, and then the water, the actual amount of water was just simply overpowering. And after floods, we know that there's going to be an increased risk of disease outbreaks. We have hepatitis C, gastrointestinal diseases, and others, particularly in areas with poor hygiene or displaced populations. Now, it's not poor hygiene because people want to have poor hygiene or they don't know better. It's because people are displaced into shelters, and shelters may be in your schools. And because of that, we have safety issues, security issues, nutrition issues. The preparation of that food suddenly becomes at risk because we have sanitation issues. If there's no clean running water, if there's no power, we can't get some of the things that we need in order to keep conditions and such that prevent disease. So we have escalated issue upon escalated issue upon escalated issue. And do not discount the psychological distress factor in survivors. We know that this can exacerbate any physical illnesses that are present. And also we just need to be aware that there are people in our communities, in our school families, that may have relatives who are displaced. They may be displaced themselves. They may be hosting displaced families. The idea that someone could come back to their home and have it not be there, have lost everything, and still want to make sure that their children are educated, safe, and fed, it's such an admirable trait that we see in so many people that we've seen come through some of these disasters. So we hope that you have a great plan in place so that you can help your own community. You know, if I didn't know where this picture was, would have thought it was taken in my hometown. I live in Charleston, South Carolina. We have many, many bridges. And when someone cries here, it floods. It just floods here. And it overtaxes our hospitals, especially our downtown ones, because you can't get to them. And so our other hospitals in other areas of the city become taxed. I actually have a friend who dispatches the internal ambulance transports between hospital to hospital. And he was telling me that when they were evacuating some folks when our downtown flooded, they had to evacuate them as far as 45 to 50 miles because of their very specific health care needs. So it's not like you just, you know, put someone in a bus and move them over to Hospital B if Hospital A is unavailable. Additionally, the transport has to have very specific types of equipment on it to deal with very specific types of conditions, and people have to be certified and available. So again, we have really complex factors that come into play when healthcare is at issue. And there are some other pieces and parts of this that I think are important to discuss, and those are things that I think about that cause illness until a little bit too late, especially when it comes to children, and children are curious creatures. I actually, during Matthew, we had an alligator walking across our street. He was just looking for a new place to go. And we have seen an increase in my area in copperhead snakes. We're very cautious about the different types of spiders that we have here. Personally, I'm very close to a river. And when we had our 1,000-year flood event, not only did the rain sit on top of us and create significant flooding because our sewage systems are challenged, our infrastructure is challenged because we're only about 7 feet above sea level. But more important, once that water started to drain, it drained off into the rivers. And the rivers overflowed their beds. We had secondary flooding situations. We had bridges wash out and roads wash out. And along with that, we displaced an awful lot of rodents and other those types of creatures. And then we have the biggest culprit of them all, and Ken's going to talk a little bit about this, and that is the mosquito. Of all of the airborne and insect-borne diseases, mosquitoes are the culprits of so many. Ken, you want to talk a little bit about our friends?
Thank you, Karen. It's not as if I love mosquitoes, but I do like to make this point about them. Mosquitoes have been called the deadliest animal in the world because of the diseases they carry. Mosquitoes kill 1 million people in the world annually. About half of those deaths are due to malaria. And while malaria is not prevalent in the United States, floods, stagnant water that you're seeing on the screen, bring mosquitoes and all of the other problems that mosquitoes carry. When I look at the photo on the right, I think of rodents and molds. That is wet trash stacked up. A good breeding ground for mosquitoes and rodents, things that like to hide. Kids like to explore in that environment as they're out and about. This looks like a sunny day in the photo, but we're in the aftermath of a disaster. molds are particularly troubling in the those that have respiratory and heart problems. Very young and the elderly are particularly prone to the respiratory problems that molds bring. Again, the damp environment is a good home for those molds. Molds that you probably don't see on a normal day develop into these environments. Asthma is triggered by an allergic response. So allergens in the area that typically aren't there are now prevalent. And what you could walk down the street the day before the trash and not have an asthmatic attack. With the molds there, you might be subject to one. All of this message is about preparedness. You need to have on hand what you need to survive. And you need to think about that in advance and prepare it in advance. That's it, Karen.
Thank you so much, Ken. And what's more important here is as we're repairing and cleaning up after an event, to be cautious and careful as well. That's when so many injuries happen. And, you know, I saw someone recently after a flooding event cleaning out, tearing out a kitchen with no masks or no fans running, and I was in the facility for not more than 30 seconds, and I could not breathe at all. And they were not wearing masks or any other kinds of ventilated breathing devices. So we really need to be cautious and careful. I recognize that time is of the essence when you're trying to do a tear out like this, and you're just waiting to get back in your home when you've been evacuated. So there's so many stresses here. And again, we want to help your school facilities or your administrators be ready and prepared if it happens in your schools, and know how to handle that in a way that's a healthy manner. You know, Ken, I hadn't thought about this before, but I just thought about this. I cannot remember the exact circumstances, but I recall that there was a high school might have been about 4 or 5 years ago, maybe longer, where they had an outbreak of something. There was some sort of rash or something in the school, and so the gymnasium and sports leadership in the school decided the best thing to do was to wash the walls and the uniforms and the locker rooms with some very specific antibacterial solvent. What they didn't realize was they were going to create a huge secondary issue because they actually burned the students. Students came to practice and their skin burned, their eyes burned, their lungs burned. So we also must be diligent in understanding not only what we're supposed to do, but how to do it so that we do it safely. We also wanted to touch very briefly with you on wildfires and other airborne types of dangers that exist. We saw in Hurricane Harvey that there were many chemical and industrial facilities that were forced to be evacuated, and because of that and because of the flooding, there were explosions and fires and a release of potentially dangerous chemicals into the air. We also saw devastating wildfires this year. So there are some specific guidance for smoky conditions and vulnerabilities. First of all, just pay attention to what officials are telling you. If officials tell you to evacuate, evacuate. Don't argue. Don't think of it. Just do it. Have a plan in place for your school to evacuate. Make sure you've worked with your parents and your school system so that they understand where to meet, pick up, and evacuate with their children if an evacuation is called for during the school day. And these are things you practice all year round. If you need any help with this and preparedness, we do have a book on our website called Disaster Ready People for a Disaster Ready America. It was written by the 3 Firestorm founders, and it covers everything from hurricanes and earthquakes to evacuations, school evacuations, and family plans in order to gather and meet up again if you are separated during a crisis or a disaster. We know that during smoky or other air pollution conditions that young children and the elderly and those with lung or heart ailments are going to be especially vulnerable. So we need to keep that in mind from students, teachers, others in our facilities, vendors, whoever visits our facilities. Make sure that individuals with lung or heart diseases are have their medication on hand and that they have at least a 5-day supply. And individuals and children specifically with asthma need to consult with their physicians about an asthma management plan to stick to during a challenging situation. So that's not a bad separate sort of meeting you can have in your school with those who have asthmatic conditions. You can have some special training and education for what to do in crisis situation for those persons. If there is an air event occurring, please make sure that you're not doing anything in your home or the classroom or the school that can lend itself to compound the situation. So don't burn candles or turn on your fireplaces or fire up your gas stoves or your Bunsen burners in the lab. Don't vacuum because it stirs up particles. And please, if you're a smoker, quit. Good time to quit. The Great American Smoke Out is coming up, so if you need support, let us know. I'll be your biggest cheerleader. But remember that smoking certainly puts more pollution into the air, and we don't want to see that. So what we've covered in this first half of our session is the increase of health risks during a natural disaster. They increase because we may get small wounds, and those wounds become infected because of stagnant or spoiled water or standing water. Poisonings and gastrointestinal infections increase for the same reason. Poor water sanitation, spoiled foods that of no power, and we know that skin infections and gastrointestinal issues are #1 and really increase during a critical event. So we just have to train people what to be careful for insect-borne illnesses. Ken Mercer advises that your bug-out bag or your evacuation bag, or at least in your car, that you have a couple of things in addition to your normal food rations. You have a first aid kit. Make sure you have hand sanitizer. You're not going to always have access to water. And Ken also recommends that you have bug spray in there. That's going to be really helpful. A breakdown in water sanitation and other breakdowns in infrastructure. Remember, there's going to be a higher density of people into shelters, and that those shelters might be in your school. And you still need to conduct the business of educating students, help people keep safe, keep sanitation. There's a myriad of concerns that happen to officials and make sure your school, your students, and your parents. Now, I'm going to show you the next 2 slides, and they may not exactly focus on schools, but I want to make here is an image that you because of a hurricane in these transport stretchers that have then been loaded onto luggage carts on the way to evacuate them from the facility was flooding. And you might say Rita was in advance of Harvey or Irma or Maria. Actually, that's Hurricane Rita. And see it come along. This couldn't possibly. We have all this specific image that came out of Texas. And the reason I bring this up is because until the 15th, actually, if you are a health care facility, there's 7 dialysis centers to major hospital care communities. And it is the 2017 Emergency Preparedness Rule. It's called the CMS Rule, and the CMS stands for Medicaid. And healthcare facilities out of compliance will lose funds. In addition, illustrates your point, Ken, the vulnerability of our health. Say about that before we move on until the next area.
Totally. The previous one, this one just Houston, not ready for disaster. Thought that they wrote a new rule, and images like the one you see on the screen are evidence that you are your own first responder. So what we're going to do when this happens, and the book that Karen referenced, Disaster Ready People, is a book helping people think about how they're going to manage that photo.
And imagine if those were children. Imagine if that's your high school or your gym or your evacuation school. We don't want to see this happen. We want you to be prepared. And Ken, to keep talking a little bit, Ken, and plan for communicable illness in our schools and organizations.
Planning for community is really about getting people back to work so that you can operate. People are sick, they should not come to work. That just spreads the communicable illness. Are a lot of practices and policies covered in the next few slides about things that you should have in place to through this workforce disruption. Thinking about it on the fly typically doesn't work. These are complicated policies, complicated people, and then train, and then test and exercise. There's a lot. These things aren't easy to consider.
Well, and Ken, you know, one of the things I think our school folks hear quite often, or quite often, is that a child may say to its parent in the morning, "Good, I really can't go to school," and that parent is a wage earner for their family, or just the wage earner in general, and they have to go to work. And they may say to their child, "You know what, if you feel bad, just go to the school nurse." And so they send that child to school, and we know that that's where the issue becomes exacerbated. Suddenly we have 70% absenteeism in the school, or others who work in our school aren't able to school. Their families become ill, and it really just spreads out like a spider web, doesn't it? So we need to 6 days home, and we need to make sure they're not penalized for that. We need to teach people how to cough or sneeze. Use your sleeve if a tissue is not available, not your hand. Make sure that our schools have plenty of not only for hand cleaning sanitizer, but sanitizer, alcohol wipes, lens wipes, devices, iPads, iPhones, any phone with a screen that the kids may pass back and forth to each other, keyboards in our computer labs, the equipment in our computer labs. If you have kids all using the same equipment over and over again, we need to use gloves, wash our hands, and keep people safe. Avoid touching your eyes, your nose, your mouth. That's how germs spread. And clean, clean, clean. And the number one way that we prevent disease is by washing our hands. That's it, as simple as that. We just simply need to teach people how to do that. I had an elderly relative who Rita passed away, and she was 95, and she needs where, well, they just didn't do it as often. And she worked in hard work. She did hard labor sewing in a sewing factory and didn't get up and go wash their hands. So we had to reteach and re-educate. So we have our children young now. When children are young is what I meant. Please do work as hard as we can to educate them. So first we have displaced populations who may be bringing communicable illnesses into our area. And then we need to make sure that we're teaching to protect against infectious diseases. And then start talking about, okay, let's look at our organization. We've looked at our people. We've given them the tools that they need. We've families. We've given some tools there. Now, what happens in our school for a period of just a day, maybe by 3 days, maybe for 2 weeks? What we need to get back up and running, teachers teach, and what equipment might we need to make that happen? Can we a UPS store and their copy machine? Can our teachers teach remote? Can we set up a communication webinar or WebEx or some other type of sharing service? And you may have that already in place. Test it. Do some load testing on the body solely using that. Use your RenWeb software. Think that through. What can we do in terms of battling an illness to keep ourselves teaching a period of time? And then let's look at illness plans. Having 17 binders of information on a shelf in your facility that nobody ever looks at. Not only that, they collect dust, and dust is an allergen. We also want to make sure that we don't just have a bunch of manuals around what to do. We need to know how to do it. We need teams that sit down together, that trust and understand what is the gap. What are the gaps that exist in our plans today? You may not have a plan at all. That's an easy gap to identify and resolve. But if you have some plans in place, where are the gaps? What documents and policies and procedures are we missing? And we can help you with some guidelines in that regard. How do we have a plan that identifies triggers and then monitors for where we are in our plan? What triggers the plan? Who triggers the plan? Who communicates? What if that person is not available? Is there a backup? Is there a backup to the backup? Have you then trained on your plan and tested it to make sure it actually works? The best laid plans of mice and men are sure to go awry, especially without training. Design then support all of your internal procedures and make sure that you're doing them the right way, so you're not using chemicals in your gym that burn students, right? This is sort of an overview of what a communicable illness plan might look like. Ken, do you want to speak to this for just a moment or two?
Sure. Thank you, Karen. This slide, I apologize, it's so busy, indicates or demonstrates to be considered in a communicable illness plan. There's a lot of things to consider. So there's nothing here that you can't come up with on your own if you start and you're given enough time to do it. We know how long this takes to develop this. We've spent years doing it, and we have one available. We'll be happy to talk to you about it. It's there's a lot of things to think about.
And we've done the thinking for you on a lot of it, is what Ken's saying. So we can move that forward. Now, something else that we've done for you is we have a paper. We wrote this paper last year, but I got to say it's a great paper and it's relevant today. We gathered together experts from our expert council, from our internal sources, our founders. We have legal, insurance, and other points of view. And it's about 30 some odd pages of questions related to how to manage communicable illnesses in any organization and plan for continuing operations. You can go to firestorm.com / and download that today. Make as many copies as you need. You can share it via email with your entire organization. Buy a pizza, have a salad, sit down and talk about what's in this and how it applies to you. We'll start with the flu. What do we need to do if 40% of our students, 50% of our staff can't come into school? What are our attendance and leave policies? What happens if, God forbid, we have to do some sort of reduction in force? Can we send employees home? Can we send everybody home and just say, enough, everybody's getting too sick? Can we require them to stay? We know that we may have organizations where we have students that are stranded for some reason in our organization. We may have an outbreak. Can I require you to stay and not go home and tend after your own family? What about employees who refuse to come to work or to conduct any sort of travel related to work? Am I able to call you and say, I'm not coming in because I don't plan on getting sick, and everybody there is? What are your pay policies with regard to absenteeism, sick days, etc.? What about work restrictions or telework? Is there anything that we can do remotely? What kind of equipment would we need to provide in order to make that happen? Is it secure? Do we have some sort of a virtual private network we need to set up? Those are things you must explore today. Benefit plans, how those are inclusive of communicable illness, employee assistance programs, visitor policies, and then written all of your employees. Again, firestorm.com / illness. You can all discuss there as well. In closing in this session, we want you to think about for your school the methodology that underlies everything Firestorm does, which is predict, plan, and perform. We want you to predict vulnerabilities, plan your response, and then perform at an event occurs. Through that, we can help you as RenWeb, help you with your communication, and we're available questions that you may have. Webinars at firestorm.com, or you can reach us at our 1-800 number at 321-2219. We'll also be happy at any time to schedule an assessment for you of your current plans. Again, no fee. And we have a variety of assessments. Ken Mercer would be happy to walk any of you through that. And Ken, we have about a minute left. Do you have any closing comments you'd like to make to our audience before we close for the day?
Just one, Karen. I can't allow an opportunity influenza where they were not talking. Preventative can take about 4 against influenza is the flu vaccine. It is a quadrivalent vaccine this year, 2017-18, protects against 4 virus mutations. The CDC predicts what virus will be prevalent in our country this year. If they make that guess right, we have good protection against influenza virus. If they miss the guess, we have varying degrees of protection against the influenza virus, but the best way to prevent flu. Thank you, Karen, and thanks to the RenWeb participants.
Ken, that was the best closing remarks. It's a great point, and it's an important one, and I appreciate your being on this call today to help everyone. And again, we are available to answer any questions you may have. Thanks for taking your time to join us. Thanks very much to RenWeb for underwriting this session and the last 4 years of sessions that we've had. I'd like to invite you to join us and tell others in your organization. We have an important virtual stress test coming up in December 7th. It's called Terrorism or Lone Wolf, doesn't matter. It's going to be a 2-hour virtual stress test. We have former Secret Service agents, folks from the insurance industry, and other deadly weapons experts that are going to help walk us through these scenarios for both schools and businesses. So we look forward to seeing you then. Check it out on our calendar at Firestorm.com. And for now, I'm going to close this session. Thank you very much. Have a great day, and goodbye.
Thank you. Bye-bye.